Hello, everyone. It's Dr. Mike, and we're back here for tip number 51 in our Medical Exercise Specialist 101 ebook series. Now, tip number 51, do MET clients remain MET clients forever? So, if you don't mind, I'm going to read the passage here, then explain a little bit. Just as medical treatment should end at some point, the same is true of MET services. At some point, the client is discharged or moved into a maintenance phase. Here at the Medical Exercise Training Institute, we use the phrase functional maintenance to indicate the point at which the client moves from what we termed skilled MET services, or those requiring one-on-one or group-based supervision, to functional maintenance mode. Over the last 20 years, teaching the Medical Exercise Specialist workshop throughout North America, I've noticed the growth of functional maintenance. I've also realized a significant portion of all MET clients are in the functional maintenance phase. That trend will continue to grow over the next 20 years as the baby boomers now take over our healthcare system. As clients progress through the MET program, some will reach a plateau or at a point which they have reached their optimal functional capacity. At this point, the client doesn't need primary MET services anymore. The functional maintenance is designed to help the client maintain the gains made in physical therapy, chiropractic care, and what's gone on in medical exercise training, or MET. The functional maintenance phase is not as intense as one-on-one or group-based medical exercise training. The phase is to prevent the client from regressing back to pre-MET functional levels. Now, folks, this becomes important. I can't tell you how much our healthcare systems around the globe are being impacted because individuals will leave physical therapy, they're functioning pretty well, and then they digress or regress, I should say. And with that, now they're having more complications, they have more medical visits. So this becomes important that we maintain these clients' level of function. The loss of function after physical therapy or MET is extremely disheartening for many clients. For senior clients, the loss of function may lead to loss of independence and dignity, and that may lead to them being hospitalized or put into institutions that now cost more money. Functional maintenance programming is essential in managing senior clients. These clients often are using the exercise program to manage a stroke, a joint replacement, back injury, arthritis, hypertension, or any other condition. We developed an MET client classification several years ago, and it includes the post-rehab client, which is the client that they've sustained an injury, they've been diagnosed with a condition, they've undergone surgery, and they are less than 1 year out from that injury, the onset of the condition, or the surgical procedure. So they are a post-rehab client. That's the first year. They require a referral before you start working with them. Second type of client is the medical exercise client. This is the one that we found is in great abundance. This is the client that had the hip replacement 3 or 4 years ago, so they're greater than a year. This is the client that was diagnosed with Parkinson's 3 or 4 years ago. This is the client that had their injury 3 or 4 years ago. They're way past that. They've been through physical therapy. They have moved to another part of the country, and they may not even see the operating surgeon anymore. So this client now is a year or more out from their injury, the onset of their condition, or their surgery. And based on your musculoskeletal screening will determine if the client needs a referral from their doctor, therapist, or chiropractor, or medical clearance. If you identify any red flags, that means they now need to have that medical clearance. Next on our list is the corrective exercise client. This is the client that may have postural or muscular imbalances. They don't have a medical condition, they just have postural or muscular imbalances. And I want to be clear on this one. The corrective exercise client, if they do have a medical condition, they are either post-rehab or medical exercise. The corrective exercise client, we're just going to correct the postural faults without necessarily getting a diagnosis or anything of that nature. So this client is one that we need to make sure we screen to make sure nothing else is going on and get a good history. But if it's just postural muscular imbalances, no problem. We do whatever corrective activities are necessary and we move on. This is the client that can possibly be one that can cause you problems because you start out thinking they're corrective and then you find out they got a rotator cuff tear. They've got some other issue going on that really does require either more medical care or it requires a higher level of services from you beyond just simply corrective exercise to now maybe possibly looking at integrating an exercise program that now looks at improving function. And then lastly, the functional maintenance client. This is a client that we're talking about for this segment. This is the client that has reached their optimal level, and we want to keep them there. Because if we don't, now they have to go back to the walker, the wheelchair. They may have to go back into an institution. And maintaining independence is directly correlated to maintaining the client's dignity. This is vitally important, and I guarantee you over the course of the next 20 years, many of you will do more functional maintenance clients, and this is important, again, to help them stay out of the healthcare system, but also help them to maintain their dignity. There are many clients who need exercise to maintain their current level of function. Loss of function will have a huge impact on their lives as well as their loved ones. Functional maintenance offers medical exercise professionals tremendous opportunities to build a practice. Baby boomers are the driving force behind the utilization of MET to maintain function. Embrace functional maintenance. Develop programs specifically for the functional maintenance client. Now, folks, the term maintenance for physical therapy, occupational therapy is a bad word to some degree, because once patients get to that point, that's when the insurance carrier cuts them off. But once they've reached that point, someone needs to maintain them. My prediction for the next 20 years is that functional maintenance services provided by medical exercise or medical fitness professionals will receive some recognition from insurance carriers if you do have a letter of medical necessity with a diagnosis from a physician. And some of these carriers will pay for these services, because think about it. If the client has to go into a nursing home or into a skilled nursing facility, that costs the insurance carrier far more money. It impacts society more, and it really does have a huge impact on the family as well as the client. So I think what we'll find here is that functional maintenance will become the standard for most medical exercise professionals and medical fitness professionals around the world, and it is a necessary component of our health and wellness system. So with that said, thank you for watching this video. Please make sure you go over to MET101ebook.com and get your copy of the ebook. And if you have any questions for me, please email me at drmike@postrehab.com. Thank you for watching. Take care.